Coming up next on Primary Care, obesity medicine specialist Dr. Dafina Allen joins us to talk about how to successfully lose weight and keep it off.
And that's my goal with my patients, to help them have a comprehensive plan and help them find their best weight based on the number on the scale, but really much more based on their blood sugars, their blood pressure, their cholesterol.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. Healthy weight loss and weight management requires a combination of balanced nutrition, regular exercise, proper rest, and managing stress. It's not just about shedding pounds, but acquiring habits that contribute to one's overall health and well-being. But numerous challenges such as social pressures and busy lifestyles can make maintaining a healthy weight challenging for many Americans. Recently, there have been advancements in weight loss drugs like Ozempic that provide new options for those facing difficulties with traditional approaches. While these pharmaceutical interventions can be promising, their long-term effectiveness and potential side effects are still being evaluated. Back this week to talk about effective weight management is Dr. Dafina Allen. Dr. Allen specializes in obesity medicine at Wise Weight Management, a practice she started to provide patients one-on-one care to lose weight and change their lives. Dr. Allen, welcome to the show again.
Thank you.
Thank you for joining us.
Of course.
Should primary care physicians partner with patients and weight loss management specialists like you in order to achieve the goals that we know we can?
100% yes. And I always tell, I'm also a primary care doctor myself, that we all need help, right? You can send someone to a cardiologist, a heart specialist, and you can also send someone to an obesity specialist.
Exactly. It is a specialty in itself.
Absolutely it is.
So basically, how much weight should a person expect to lose in a week?
Great question. 1 to 3 pounds. So I always tell patients, let's have healthy expectations. 1 to 3 pounds a week is healthy weight loss that is much more sustainable.
And some people lose weight at different weight rates and phases. I mean, is that a factor that's built into that formula?
Absolutely. As we age, it is very common that we do lose weight at a slower rate. And postmenopausal women, so women that have gone through their menopausal change and are no longer able to have children, that is when weight loss is commonly much slower. We try to shoot for more like 1 pound a week, especially because the inches around our waist increase for postmenopausal women.
So how often should people weigh themselves?
Great question. So it's person dependent because a good weight loss plan is very personalized, but on average, I say about once a week. So that way you're able to check in on your weight, but we don't want your mind too much on your weight. We want it focused on your health.
Okay, so just in spite of the scale being used as not the single measurement that we should be looking at, what other things should we be paying attention to track our progress?
Great question, and that's my goal with my patients, to help them have a comprehensive plan and help them find their best weight based on the number on the scale, but really much more based on their blood sugars, their blood pressure, their cholesterol, their waist circumference, so the inches around their waist, as well as their body fat percentage as well.
So does weight loss differ between men and women? I mean, should we be saying, oh, because she is female or because he is male, that we should expect different outcomes?
And yes, it does differ. Women actually lose weight at a slower rate more commonly. Women more commonly have slower metabolic rate, so their metabolism is slower more commonly than men, meaning it will take more work, unfortunately, to lose weight.
Is that true for children also?
Yes, so children usually have higher metabolic rates as well. But for children with obesity, we try to focus less on having them lose weight, and we focus more on helping them not gain weight and helping to improve their health-related challenges that are related to their obesity.
Yeah, they're kind of special anyway, looking at growth spurts and those sorts of things.
Absolutely, correct.
But so back to the old tradition, everybody's probably been on a diet at least twice in their lifetime being overweight. Do they work? And if they do, what are we looking at in terms of success? And if they don't, why not?
Good question. So diets do work short term, but nobody's looking for short term success. And that's why I named my company Wise Weight Management, not Wise Weight Loss, because I want to help people manage their weight long term. So I don't put my patients on diets. We actually do eating plans.
Okay.
And so an eating plan can be adjusted based on where you're at in your weight loss journey. Diets do work temporarily, but that's all. It's only temporary. When you restrict yourself, basically what happens is you tend to overeat when the diet's over and then gain the weight right back.
So it's kind of useless to some degree to talk about Mediterranean or Atkins or keto. I mean, that's pretty much a smokescreen if we don't have a real weight loss management plan.
Great point. And so I really tailor my patients' eating plans to their lifestyle. Now, Mediterranean is wonderful and one of the best diets for heart health, right? So, or eating plans. But I love Mediterranean, honestly, because it actually is it's not very restrictive. But you are absolutely correct. I don't have a patient that has a diet that is based on heavy carbs, do ketogenic diet, because that's not going to work for them in their lifestyle. But so yes, I do try to focus away from like which diet is the best, because there's so many studies that have shown the best eating plan for a patient is the one that works for them. Now, modified low carb, or at least where we are eliminating or cutting down on added sugars, those eating plans work. And also we do know that lower calorie diets are more effective when they are monitored. So we just have to monitor it if we are going to cut down someone's caloric intake.
So when we look at success factors, basically 4 areas that we look at: exercise, diet, stress management, and sometimes the all elusive sleep. Let's start with healthy eating.
Right. So, I'm going to keep saying it because it's my big passion. All my patients, they're going to get a comprehensive plan, right? So eating is the number one focus. You cannot exercise off a unhealthy diet.
Right.
And so people, the first thing you say when you talk to a patient about weight loss, they say, I got to get in the gym. I'm like, no, that does not mean you need to get in the gym. It might mean that we do need to help you with your eating, because that is the number one role. So healthy eating for everyone includes a diet that is rich in plants, proteins, and healthy fats. And so I have learned that from multiple studies in my experience with patients, as well as learning from other obesity medicine specialists, that eating that is rich in vegetables and fruit, veggies first, vegetables, fruits, and then healthy plants like whole grains, as well as protein, great sources of protein. It doesn't have to be animal protein, but protein and healthy fats. So those omega-3s that are found in fish, if you do eat fish, they're found in walnuts, they're found in avocados, olive oil. We can have a diet that's rich in fat as long as it's those healthy fats that are going to contribute to our heart health.
So how do we face the problem of portion control? That seems to be, let's put it like this, portion control is out of control. Okay? How do we face that?
Good question. So some of my patients that really do have challenges with becoming full and overeating large portions, the one focus that I start with is protein. So making sure your first meal of the day is high in protein. So that might be, at least 20 to 30 grams of protein to actually help, because if you're getting enough protein in, you're not going to feel as hungry. Healthy fats as well and fiber are other factors that contribute to more fullness, and that really helps those patients that are having trouble managing their portions. And I tell patients, if you're still hungry, eat more chicken breast, eat more broccoli, but let's watch the amount of the white rice or the bread or the heavy pastas, because those are the ones that are going to contribute to weight gain more. If patients feel less restricted, they feel more empowered, and they're going to lose weight better than the ones that are restricted.
What's your perspective on the intake or the ingestion of liquid sugar? We've just got a predominance of people who are stuck on pop, stuck on juice, And when we try to quantitate it in our office, it just turns out to be a tremendous amount over the course of a week.
I have so many patients that I work with in the Black community that they start losing weight when they just cut out pop. It's amazing, but there is an addictive component to sugar. Absolutely. And so first, making sure patients are aware that, hey, this is an addiction. So this might be a challenge to break, but we can do it together. Just starting to educate patients on just starting with the sugary drink and saying, hey, let's try to replace half of your pop with water. Because maybe if you tell someone you're going to take away their pop, that's,
Yes, tough.
Right, but let's replace half of that with water. Oh, you don't like water? I tell patients, not liking water is like saying, oh, I can't wear shoes to school. You just have to find a way to wear shoes to school, right?
Absolutely.
So maybe we might need to drink it ice cold.
Right.
Maybe we might need to drink it room temperature. Maybe we might need to add some fruit to it, even frozen fruit, just to give it more of a flavor. Add a lot of ice to it and train your taste buds. You can train our taste buds to
absolutely.
appreciate that so that we can cut down on some of those sugary drinks that are, everywhere that absolutely contribute to weight gain and diabetes.
Right. What about the hidden sugars? I find that when we read labels, we are shocked about what the contents of. Why would we add sugar to mustard in this country over the last 50 years and watch that content go up every decade? I mean, people, if they don't read labels, they don't know.
You are so right. And actually, I would say 9 out of 10 of my patients, when I ask them, are you comfortable reading a nutrition label? They'd say no. And that's every education level. So first, it's just educating our patients. I just keep nutrition labels in my office. I'll grab it and say, hey, let's just look today at the carbs.
Right.
And look how this says added sugars, because those are the problem. You're so right. Ketchup, barbecue sauce, spaghetti sauce, regular staples, right? The more of it you eat, the more you're going to crave, right? So just by being aware, and when you're at the store, picking up that label and looking at it, and that can be a huge factor to improve your health. And you're so right. We have to learn what those sugars are, because there's a lot of hidden sugars that are in everything, and doing our best. I always tell patients, we're going to keep it simple. Maybe you might not cut out ketchup and barbecue sauce or make your own sauces, but hey, at least if you're aware, you might use less.
Right.
Or you might try some mustard that doesn't have any added sugar instead of all the barbecue sauce. And that's still winning.
Exercise, get off the couch.
Absolutely. So there's those 2 parts of activity that are so important for a good weight loss plan. So there's going to be the exercise part, and there's going to be the part of the movement, the NEAT we call it. But basically it's the, non-exercise type activity. So I talk to patients all the time that say, oh, I don't need to exercise because I run around with my kids. But I say, well, but if you are affected with obesity, the running around with your kids is great. Keep doing it. And we should all try to get up at least once per hour to stretch out. If we have a sedentary job, try to stand up, stretch out your legs, get up and move your body around. On the other side of that, we also do need cardio exercise. It's going to increase our heart rate. And we do need resistance to contribute to weight loss. We cannot avoid one or the other, but we can find something that's enjoyable. Exercise is all about enjoyable. And when I have patients that tell me, I don't like exercise, I say, there's 100 types of exercise. So let's work together to find something. And if your exercising is walking, go on a walk. If you like to dance, go dance. Everyone doesn't have to do an exercise class or be in the gym for an hour to find a way to move that works for them and their lifestyle.
Stress management, the one thing that seems to be elusive in our society with people's lifestyle now being what they are, what can people do to actually reduce stress? We know it's a factor. I personally, I don't think hard work hurts too many people, but I think hard work and stress is a bad combination. What can people do to identify the stress and reduce that stress?
Those are excellent questions, because I have so many patients that talk to me that say, I can't control the stress. You're telling me not to be stressed. I can't control that I had this loss or this trauma or I'm dealing with this situation. And I say, you are absolutely right. But we can give you some healthy tools for dealing with your stress. So yeah, you want to sit on the couch and watch Netflix to relieve stress for a few hours. There's nothing wrong with that. But we also need stress relieving activities that do not involve a screen and that do not involve eating or drinking. And I have a list that I keep on adding to it, and I give it to my patients, and we go through it together. So, hey, maybe you might want to do some painting. Maybe you might want to go dance, take a walk, call a friend, pray, or meditate. But it needs to be, what can I identify? What can I do? Instead of reaching for food or instead of just sitting down and watching TV. And like I said, it is okay to have an ice cream if you're upset. But if that's your main way to cope with stress, then you will likely be affected by obesity and your health will be affected too.
Sleep is important. Sleep is our restorative, our regenerative activity throughout the course of the day that helps us function better the next day. How much sleep should the average adult be getting?
Great question. So 7 to 9 hours. I'm sure you talk to your patients as well as I talk to mine, and they're going to say, oh, I'm one of those people that can function off of 5 hours of sleep, right? And I'm like, hey, well, I'm happy to hear that. But if you are needing to lose weight, we need to get you in that 7 to 9 hour range. And hey, maybe you're a busy mom, you're not able to get 7 hours, but every amount you get matters and the type of sleep matters. So if you're not getting quality sleep, then you also are going to have a much harder time losing weight. When you don't get adequate sleep, your cortisol stress hormone levels increase, which also increases the amount of fat around your waist. And so just doing whatever you can to be intentional about your sleep, trying to cut off those screens before bed, and talking to a sleep specialist if that's needed. Definitely start with your doctor if you know that when you wake up you're not rested, because you will have a lot of challenges losing weight if we're not addressing that.
Dr. Allen, tell us about the new fancy drugs that's got taken the country by storm. Okay, the Ozempics, the Wegovy's. Tell us about them and how do they work?
So these are GLP-1 agonist medications. So they basically are.
What's a GLP?
Yeah, so it's basically your fullness hormone. So your brain has these receptors that the GLP-1 hormone communicates with these receptors to tell you that you are full.
Right.
And so the really cool thing about these medications are they help patients eat less. And so they are able to eat smaller portions and they become full faster, and some of them are rivaling the benefits like bariatric surgery. So they've been very effective and making my job a little bit easier sometimes.
How safe are they? That's a question that people continuously ask. What are the long-term effects of them?
Great question. So, GLP-1 hormone medications are not new. They've been in the diabetes world for a very long time, and they do have certain risks associated with them. More commonly, higher risk for those that are taking them inappropriately. So they are safe if they are monitored, because they do have risk of nausea. You do have a risk of vomiting, more commonly constipation as well. But the big thing is they are indicated for those with obesity or overweight with a medical condition. So we're seeing a lot of health complications for those that are taking them that do not have those medical conditions or do not have obesity.
So if a patient comes in and we're considering them for one of these drugs, what's the length of time that they can expect to stay on the drug and administer it themselves?
So for anti-obesity medications, the GLP-1 medications, they are indicated for long term. So even if you look up on the label for the medication for chronic weight management, so I always explain to patients that we put you on this medication, we need to understand and expect that you are going to be on it long term, the same way we're thinking about your cholesterol or your blood pressure. Now, if you are going to stop this medication, it's really important to slowly cut down the dose, because a lot of times if you stop it completely and quickly, patients will gain a lot of weight quickly.
Yeah, there's a rebound effect.
Absolutely.
Right.
And remember, these medications are working on that hormone. So when you take that away, then patients are going to feel a lot hungrier and there is weight regain that is expected.
So it's not a decision that we make very lightly, and especially with initial consideration for a patient. At what point do we consider using one of these drugs? I mean, is it after we fail to some degree or what?
So a lot of the insurance companies will still say to get these medications approved, you fail dietary and lifestyle modification, which kind of makes the patient feel like they're losing, right? I absolutely consider them when I am sitting down for the first time with patients. Now, I might not start them on a medication on day one, but I do consider these GLP-1 medications once they are on a weight loss plan. If your BMI is 30 or higher, I absolutely will consider a GLP-1 medication. Sometimes, if it's 27 or higher with a medical condition, I use a lower dose normally on those patients. But if it is someone that specifically has trouble becoming full, people that have challenges with eating multiple portions of food, also overeating, which is #1 eating disorder, binge eating, that is the perfect patient to consider prescribing a GLP-1 hormone medication.
Everybody's concerned about cost in this industry, no matter what we're doing, whether it's a test or another prescription or whatever. Where are these drugs lining up in the scale here in terms of cost? And do you consider cost a barrier to treatment?
So unfortunately, yes, the cost can be a significant barrier to treatment. And, the medication is very effective for most, not all. But basically, if the medication is covered, it is usually less than $50 a month for these GLP-1 medications. If it's not covered, it's going to usually be $1,000 a month or more.
I've seen those kinds of numbers, yes.
Yes, which amazingly, sometimes patients will max out their credit cards to take these medicines, right? But it is a significant barrier. And the unfortunate part is the insurance companies are the ones that dictate it, as well as human resources. A lot of these employee benefit programs, because they have a hard time affording these medications that are very effective, but can be very, very expensive.
So even in developing a successful weight management or weight loss program, there are disparities that exist. I mean, if you've got a job that is not necessarily high paying cash is out of the question for you. Most jobs that don't pay well don't have very good insurance coverage. I've never seen anybody have great insurance and a low paying job. That probably doesn't exist anymore. So basically, for the community that we serve and the populations that we serve, we have to take that into consideration as we prescribe.
Absolutely. And I tell my patients that do have challenges with their income, we have other options as well. So, in the field of obesity medicine, these GLP-1 medications are great. They're exciting, and I'm so grateful because they work very well for many. But I do prescribe other medications as well that we still monitor and make sure patients are safe with these medicines. And we also look at the other medications. So a lot of medications that people are prescribed can contribute to weight gain. And so my job is to also look at those medicines, communicate with other physicians that may be prescribing them to find out, hey, is there another option? Can we lower the dose? And then always, always focusing on the eating, the exercise, as well as the stress management and sleep. Because even without these medications, there still can be help for these patients for long-term weight management success.
So this story, this approach really can be taught. I don't necessarily think that we're training people necessarily, but we can actually improve their level of understanding about weight management and weight loss. And we can do that through various means. I mean, have you had an opportunity to work with community groups, churches in particular, social groups, senior citizen environments? I mean, have you had an opportunity to do that?
I absolutely have. And one of my favorite things to do is speaking about how to help patients or how to help people with healthy living with any lifestyle. And so I do a lot of speaking engagements with churches. I do health fairs, fraternities and sororities, as well as different events. I also speak to different organizations as well as residency and medical schools about how do we help ourselves with healthy eating and staying active with a busy lifestyle. So let's be honest, most of us have a busy lifestyle. And so that is one of my big passions, is trying to help people with how they're able to make changes to their current lifestyle, but not where it has to be a complete overhaul. Really, I like to speak about changing habits. So as we establish habits, that is what gets people long-term success. Habits over willpower and motivation. Yeah, we want to have willpower and motivation, but on our toughest days, we will revert to our habits. And I love speaking about that to people.
I think that's important. I mean, we are creatures of habit, truly. What about patients who are resistant? Everybody is not following our recommendations and not adherent to the medications that we prescribe. In the weight management arena, what about patients that are resistant? Is there a special approach for them?
Great question. So really, I'm just about keeping it simple and helping patients and meeting them where they're at. So if I do have a patient, and even in my family medicine practice, that I say, hey, can I talk to you about how your weight affects your health? And they say no. I say, okay, well, that's fine. I'm going to refill your medicine, and let's talk about eating veggies and how that also can improve your blood pressure. So I'm really all about meeting people where they're at. And when patients feel like they are being supported, even when they are not following through with the plan, they come back. And patients that come back are known to actually be more successful for those that don't. I always tell patients, if you follow nothing I say, come back.
Right.
Because just sitting down and us developing a relationship,
Exactly.
you're going to be able to find out why maybe they're not following through. And that plays a role as well.
It's all about communication. It's all about the conversation. That's very, very important in almost anything that we do. What message would you like to leave with the viewing audience today? What a bottom line message?
So bottom line, I want to make sure people understand that weight management and treatment of obesity needs to be personalized. So we want to make sure that people are being treated with respect and not focusing on things they're not doing, but trying to encourage our patients and meeting them where they're at so that they feel empowered to make healthy choices in their life. And also small changes can lead to big gains,
results, yes.
Absolutely big results. And so I want to continue to make sure people are aware losing 5% of your weight can contribute to lower health risk. And don't focus on the scale, focus on those victories that are not related to the scale.
That is excellent. Good. Dr. Allen, thank you so much for joining us today. This has been outstanding.
You're welcome. Thank you so much for having me.
Good. Our pleasure. Our guest has been obesity medicine specialist Dr. Dafina Allen of Wise Weight Management. Sustainability remains a key aspect of successful weight management. Adopting lifestyle changes that are realistic and sustainable over the long haul are crucial to maintaining progress. For Primary Care, I'm Dr. Lonnie Joe.